Hello, everyone. My name is Larry Cole, and I am host of COVID Impact 360 Conversations. Today, I have our Chief Science Officer, Doc Roy, at COVID Impact 360 Consultancy. And 2 months ago, Roy and I got together and we did a video about the history of SARS-CoV-2, which is a virus, and COVID-19, which is the disease that you get from the virus. And from that 1 hour video, we got a bunch of really good questions. And I thought they were framed really well. So we decided to do shorter versions of each one of these questions. So we are now up to, for the public to know right now, is we're up to question number 8, and it comes from Stephanie R. And Stephanie asks, can you please explain in more detail what you meant by containment, mitigation, public health and social measures, and MPIs? Thank you. So yeah, take it away.
Yeah. Thank you for the question, Stephanie. And within your question, I think you meant NPIs, which stand for non-pharmaceutical interventions. They're actually a form of public health and social measures. They're included in with each other. But some people like to use PHSM, other people like to use NPI. So that's why they're both included in the video. Okay. So when we're talking about viral containment and mitigation, in any kind of a pandemic situation, there's a key concept we have to all understand. And many of you have heard it before, but probably don't really understand what it means. It's called the basic reproduction number, or R naught. Okay. It's a term that scientists use over and over and over again, but they usually forget to explain it to the public what it really means. The reproduction number of a virus, or R naught, is the number of people on average that one infected person will subsequently infect. Okay? A pretty simple concept. If I get the virus, how many people am I likely to infect now that I have it? Okay, without any kind of protections. If R naught, or the basic reproduction number, is equal to 1, it means that an infected person will just infect one other person on average with SARS-CoV-2 and the transmission of it in essentially a steady state. If R naught is greater than 1, which it has been for the last 5 years, okay, the transmission of SARS-CoV-2, the virus, is increasing, and each infected individual infects more than one other person. As of a few weeks back, the R naught for Omicron XEC, as an average globally, was about 3.16. So one person on average infects 3.16 others. Okay. And so the goal of containment, or any mitigation strategy, is to decrease the basic reproduction number and the rate of transmission of the virus. Okay. And this reduces the spread, decreases the amount of disease, and it protects the capacity of the healthcare system. Pandemic containment and mitigation strategies must be able to quickly transition, okay? Because as the virus changes, and we've all seen it change through 5 different variants of concern, okay? And they all had different ways that they kind of expressed themselves. They were all different versions of the virus, and some of them were quite deadly and quite quickly. So we have to be able to move quickly and to pivot around what the virus is doing. And those are the essentials of what containment, mitigation, and public health and social measures and non-pharmaceutical interventions mean. So in a general sense, containment strategies try to reduce the risk of transmission, and they can be anything from wear a mask to shut down the whole world, okay, depending on what's going on. Mitigations, we try, essentially are in the same continuum, and they're just to slow down the spread of the disease, okay? And if we have a large amount of a disease happening in any one country or any one part of one country, then we have a huge risk of exceeding the capacity of our healthcare system. And you'll see by the end of this that that is really the bottom line here of all of these. So, in practice, containment, mitigation are really used concurrently with each other, and they're part of a continuum of strategies to one, decrease the amount of transmission of the pathogen, the virus, and to protect the capacity of the healthcare system. We don't want a virus to go uncontrolled. Okay. And when I talk about public health and social measures, understand that they include non-pharmaceutical interventions, NPIs. Okay. So public health and social measures, okay, these are basically the only things that a resource limited country can do to protect itself. Okay. They don't have large hospitals, or if they have one, they might have one in its capital city. But all throughout the rest of the country, they just simply don't have the ability to have a healthcare system like we would find, in any of the OECD countries, the wealthy countries of the world. So think the United States, Canada, all of Western Europe, lots of money, lots of healthcare capacity. Well, that doesn't happen in more than 100 countries of the 164 recognized countries by the UN on the planet. Okay, so the majority of the countries we recognize don't have the ability to provide that kind of healthcare to its citizens. Okay, so they are left with these public health and social measures as their only way of fighting back until someone can bring them some therapeutic drugs, or they get around to their turn at getting their vaccine distribution. Okay, and even when that happens, it's really difficult to distribute to very remote places, especially when many of the vaccines we used required hyper cold transit kind of conditions. So the one of the mRNA viruses required to be maintained at minus 70 degrees C. That's pretty difficult to move across an entire country in Africa and keep it that cold. So it takes an awful lot of logistics you know, to make that happen. So what do they have to be able to protect themselves? They simply have the same strategies that we've been talking about. What can they do and what can governments do? But understand that in resource limited settings, public health and social measures, these mitigations and containments that you can bring in, are your only savior, because this virus can overrun a very limited resource healthcare system in a big hurry. So they use them, and they use them effectively. And many of the countries that I helped lead throughout the pandemic fall into this category. Okay. And I'd like to say, just break these down into some so you understand them. What would be personal measures under mitigation, containment, public health and social measures, or even NPIs? Okay, they're really simple. Okay, they're washing your hands, hand hygiene. Okay, you don't touch your face after you've touched other things. Okay, don't touch your eyes, don't touch your nose, don't touch your mouth, because that's how you transfer the virus. Okay, if you have to cough or sneeze, do it into your elbow or use a handkerchief. Okay, mandatory masks and respirators are one of the things that you can do to help everybody, and it's in any setting, whether it's a poor country or a rich country. You should have an N95, KN95, or FFP2 mask on your face every day. One, you're protecting the vulnerable, and two, you're protecting everybody else from you and them from you itself. Okay, so both are important. What else can you do personally? Social and physical distancing, cleaning and disinfecting the surfaces in your home, and where you can, season dependent, you know, improve the ventilation in your living space. So if it's the summertime, open up some windows and get airflow through, and you decrease then the chance of airborne transmission because you got a breeze brewing through. Now, what do local and national governments have in their reserve? Okay, and remember, these have been around for a very long time. Many of these are mandates, and many of these have gone through legal challenges and have held up over the last 60 years. So I really don't want to get into a debate with anyone over these, but they're extensive. So governments are responsible for surveillance and response measures, and also reporting to places like the WHO and the CDC, et cetera. Okay, they initiate something called, molecular testing, which is usually RT-PCR, but there are other versions. And you also can do antigen testing to all people in its population. When you find a positive case, they have to isolate, and you have to do contact tracing. That's a government-run function. So that means you find a positive case, then you ask that person, you do an interview, and you say, how many other people have you been with in the last 2 or 3 days? And can you list all the ones that you think you've been with, and you have their phone numbers? And then we contact each and every one of those. And each and every one of those, until they can be tested by a molecular test like RT-PCR, they have to go into quarantine. So these are contacts of a positive case. We have no idea if they're infected or not, but they must go into quarantine until they can be tested. Okay. Another one of the rules that has been in place for a long time. Okay. So then also we get to school closures, working from home, closing non-essential businesses and services, restricting the use of indoor spaces, canceling limited gatherings, and canceling or restrictive mass gatherings. So if you had tickets to the concert, you're probably not going to get to go when we're having a peak of virus, and these are in place. And so others would be protecting the elderly and the most vulnerable. That's a group one, but it always follows under the government responsibility to tell us that we're supposed to do this. Okay. Protecting displaced populations. Now, people go, why should I care about that? Well, it may not be in your normal sphere that you see displaced populations, but if you happen to be a global citizen that travels a lot, you will know that there are several countries in the world right now that are in conflict. If you think of the Sudan, more than 11 million people have been forced to leave their homes and live in IDP camps. So governments have a responsibility to provide the same measures and the same drugs and the same vaccines to people in an IDP camp as they do to their own citizens. And this is done through international cooperation. Okay. Now, also, you're protecting those displaced populations who in our regular society is kind of in the same boat. People who use homeless shelters and in our prisons. Okay. So prisoners have to get the same amount of protections as anybody else gets. That is their right, and it's a government function. Suspending or restricting movement domestically, stay-at-home orders, which most people don't like, providing travel advice and warnings is a government function. Closing national and international borders is another. Restricting entry and exit into a country, which happened during this pandemic, okay, in all countries. Travel, isolation, and quarantine measures. See, mandatory testing, masking, and vaccine passports for flights. I don't know if most of you realize this, but as we started to open up in early 2022 and planes started flying internationally again, okay, to be able to get onto an airplane, you had to have an RT-PCR test that was negative within 48 hours of your flight. You had to have an N95, a KN95, or an FFP2 mask on your face when you're in the airport, when you're in the departure lounge, And for the entire flight, you're allowed to remove it only when you have a quick meal. Okay. Many airlines also require people to either have goggles or a face shield. Okay. Now, you also could not get on that flight unless you could prove that you had the latest up to date vaccine, and it was called a vaccine passport. So not only did you have to get tested, had you mandated you had to have an N95 mask on. You had to have a vaccine passport showing that you had had those recent vaccines. And then when you land in the country that you want to go to, you don't get to go to your hotel. They're going to hold you for 2 hours and they're going to do an RT-PCR test again, because 40 hours before the flight to when you arrive, anything could have happened. You could have gotten infected on the flight. Okay, so they will test you again. They will take down all the information where you're going to be in that country of travel. And if you come up positive on the RT-PCR test, well, you are then put in quarantine and you're left in quarantine. We normally call it isolation. International governments called it quarantine when you arrived in a country and you turned up positive. Okay, so that's a very real thing that happened in this pandemic. And if you weren't traveling at that point, you probably didn't know how restrictive that was or how difficult that was to comply with, because trying to find an RT-PCR test within that 48-hour window before you're going to fly, there wasn't much you could do spontaneously then. You had to plan these trips out in advance. Okay, we're almost at the end of them here. Okay, so the other ones obviously would be stopping international and domestic flights, suspending ferries and ships, complete city, state, and country lockdowns, and then using medications for prophylaxis. We often had some viral medications we thought would be of use, and we would give them out for you to take. And then, of course, promoting vaccines and vaccine mandates as soon as the vaccine was available. So we started giving out the vaccines to everybody at the beginning of 2021. Okay. So this entire list that I've just given you of your personal and the government responsibilities are not things that all happen at the same time. That could be catastrophic because it would really affect people's mental health and all of this, to have all of this dumped on them at once. These are the lists that they get to choose from, dependent on where the virus is at any given time in their population, to be able to protect their population. Okay, so it's important to understand that there's a real purpose between how and when we implement these strategies of containment, mitigation, and public health and social measures. And there's just one key purpose for all of this. Okay, maintaining healthcare capacity is the key driver of any containment, mitigation, and public health and social measure strategy. Okay, there is no other reason for it but that, because without the maintaining the healthcare capacity, we end up with healthcare collapse. So it means the entire hospital gets flooded with only COVID-19 patients. Everybody else has other diseases, never even get in the door, but the healthcare system itself can't handle even the COVID-19 patients. So the healthcare system collapse, and it only leads to one thing when that happens. Okay, because the epidemiological curve has exceeded the healthcare capacity. And think mainly ICUs, but when it gets really stretched, we put people in beds and all over the place. But ICU capacity is important to think about, because it doesn't matter how many extra respirators you have or how many extra beds you can cram into an ICU. That's not the limiting capacity of an ICU. It's the highly trained professional physicians and professional nurses that do nothing else except intensive care medicine. Many of them have been trained for more than 13 years to do that. They are the resource that's limited. Okay. Once you exceed their capacity, you're in big trouble. Okay. So that's why this is the key purpose. to protect and maintain that healthcare capacity. And in there, read ICU capacity to start with, because that's where it always starts. And if you don't do it, what happens is we end up with uncontrolled morbidity and mortality across the scale, across the world. Okay? The virus wins. And a lot of us don't survive to stick around to see what the next pandemic is going to be. So if you think that these mitigation and containments and public health and social measures, or sometimes also called NPIs, non-pharmaceutical interventions, are onerous, yes, they can be. But they're onerous for a very particular reason. Anytime any healthcare capacity gets exceeded, the healthcare system will fail. And not only will it be the pandemic that's killing people, but all of the other people who would have needed that hospital because I'm having a heart attack, I'm having a stroke, you know, I can't breathe, my kidney dialysis is needed today. All of those people die as well. Okay, that's why these measures can be so extreme. So they go from quite ordinary to incredibly extreme. And the one where I said where you stop borders within, between countries also means within countries. So during this pandemic, if you think of Canada where Larry is, you could not travel from British Columbia to Alberta at the height of the pandemic. It wasn't allowed. You could not travel between provinces. You could not fly between provinces. You couldn't fly anywhere. Every plane was grounded. Okay. And this can happen even within cities. One area of the city can completely be off limits to another area of the city. So these are measures that we implement with great thought and great care. Okay? We don't enter into them lightly, and we've got more than 60 years of experience in using these measures to reduce the transmission of a pathogen like a virus. And we know what happens if we fail to do so. Okay? And I'll say it again. It leads to uncontrolled morbidity and mortality in the society. And we can't let that happen, ever. So if you don't like restrictions put on you, this is why they're there. Okay? It means not just you, but the entire society could go down in a pandemic if we're not using these tools effectively and appropriately. So thank you for that question.